Section 5. This is, of course, Chris Kramer coming at you for our Block 1 wrap up. I'll be doing these every 2 weeks to kind of wrap up the summary of the last 2 weeks or the blocks that we've been covering. I'll try to keep it under 10 minutes, although I tend to go a little bit beyond that. Hopefully you find them useful. I like to just be able to recap so that you can hear me in my own voice as I've already been typing to you guys my opinions and my thoughts, and this kind of encapsulates them, hopefully in a short amount of time, and you find this useful. Okay, so first off, moving on to the next slide. First off, the thing is I want to remind everybody a few housekeeping items. We're going to paste in the same groups for next block. So remember, Sunday evening, that's when we start to post our stuff. So first off, you guys did a great job of getting your posts up like Saturday and Sunday, which I love because then I can get after them on Sunday. And it's easier for me to get into them on Sunday. Monday's a little busy for me, and Tuesday night I can usually do some things, and sometimes Monday night. But it's great if I can start to dig into them on Sunday. I think I really appreciate that. Secondly, so we got a lot of activity early, but people tended to drift off after about Wednesday or Thursday, and I'd really encourage you. So first off, people need to you need to respond to your posts, and the original posts I thought were really good. I mean, I was really impressed with the depth of information. I expect that in residencies, and I sometimes don't always see that maybe with some of the manual therapy patients. But man, I was very impressed, and I thought, nice work. We dug in. We had some good conversations. I had some really good conversations, but then it seemed to trail off, and I know that Eric had mentioned that as well. So I want to push you guys to make sure that, I realize, I mean, I'll talk about grades, but I mean, that's really irrelevant. We're going to go beyond that and think about what this is trying to offer you guys. And there's a lot of value in the discussion. I mean, I learn great things from you guys, just how you think about things, how your companies are doing things. So please, please, please. This is more than just about grades. This is about the ability to professionally interact. And I get it, you're busy, but it doesn't take long to respond to a post or to read an article in depthly. And I know that I post a lot of articles and try to get you guys to think a little bit differently. So that does take some time. But I do appreciate the continued dialogue. Highlights from the week. Okay, so bottom line, medical screening. You guys all really seem to understand that regardless of where they come from, they need to be properly screened, right? We are continuous, and it's not just in the initial eval. It's through the continuum of care that we're offering. We are looking at red flags and yellow flags, right? We are constantly screening these things out. A lot of you guys picked up on, or were enlightened, if you will, by some of the questions needed about regards to referral into the shoulder that come from different systemic kinds of problems. I think there's a lot of nuanced questioning that goes on in the Goodman article. And I think the important thing is to understand that we recognize what is musculoskeletal and what is not. We're trying to rule in or rule out, depending on how you want to look at it. But we first thing need to ask ourselves, do they belong in our clinic? And more often than not, they do. You have an obligation to continue to screen to make sure that's the case. However, I feel like I felt like that and so I thought you guys all zeroed in on that, but the yellow flags, man, that is where we are going. And the research continues to point us in the direction of this biopsychosocial model that we need to be able to address. And that if we aren't addressing this, if we are treating this simply as a structural problem that doesn't have a brain attached to it with fears, with anxieties, with maybe depression, with other psychosocial stressors that are going on, we are missing the boat. And a number of people, I posted a couple of articles about how to interview people, the empathy and what value there is. So one of my points here is yellow flags are not a passing fad. This is very, very important, and we need to be addressing these other things that play into a heightened sense of sensitivity within our nervous systems. And I think we do that through empathy. We do that through listening. We do that through understanding. And we do that through compassion. And empathy has been shown scientifically to be very effective. And an empathetic encounter, that patient leaves our clinic feeling known and listened to, right? And so that's once they have that, then they can trust you. And because if they don't trust you, the red flags and even some of the yellow flags don't come out. They keep it in because they don't feel like you're listening to them. They don't feel like you want to know what their deal is. So make sure that you understand that yellow flags are a big, big deal, and that they will be a key to you having a successful interaction with your patient, and having that patient come back to you and say, hey, you helped me with this. Can you help me with this? It's very, I feel like it's very important. Outcome measures, use them. Most people do. Um, I would argue that they have real value. I think as you get better at what you do professionally, you start to see patterns, and maybe outcomes are good at just kind of helping you nuance your practice. But especially in the first 6 to 8 years of practice, they are constantly giving you feedback about what you need to do better. And I think there's huge value. And outcomes that have some scientific reliability and validity. There's a couple of outcomes that were posted that I think have really good intentions, and even I posted one that has good intentions, the OSPRO, but it has room to grow. So understanding properties, right? MCID. Is it helpful to know? I forgot to put my question mark. I posted to some people that Chad Cook gave an interesting presentation at AOMPT in regards to the value of MCID and how it's a little bit of a cluster as far as like the strength of an MCID. I think right now you can use it and try to feel like it's of value and maybe even point it out to a patient, but I wouldn't hang my hat on it. In the future, I could see the MCID going away. Also in the articles this week, the benefits of clustering. The Weiner article talking about CTS and the Hegedus article talking about shoulder impingement. In that Weiner article, I thought that what was really interesting was that 34% of people who have cervical ridic or who have CTS have a cervical ridic or have had that diagnosis. Anybody who has carpal tunnel needs to be appropriately screened for any kind of neck involvement. And I would argue anybody who has carpal tunnel should probably be you should be treating their neck. Like I treat anybody from the neck down, shoulder, elbow, wrist. They're going to get a neck assessment, and more than likely, I'm going to treat their neck. And it may be passing. It may be something as simple as side glides with some neural tension, or it may be just an assessment of hypomobility and a thrust, or maybe a thrust in their upper back, just because of some of the different literature. And it takes minutes, if not seconds, to do that. But understanding the value in treating kind of globally, but getting back to the value of understanding, in that Weiner article, the handshaking, how that had a high sensitivity. So if they weren't doing that, they probably didn't have it. And then you combining those other things like the upper limb tension test, another test with a high sensitivity, right? So if it's negative, we can be fairly confident that it's probably not part of the CTS in combination with these. Because as I'll say to you, and as I will say to the University of Minnesota students and the St. Kate students that I teach, and also in some of the other CE courses I teach, special tests, they aren't so special. Right? They really aren't special at all. And so we try to make them more special. And even in the Hegedus article, we talk about combining painful arc, Hawkins Kennedy, and years to get this, to try to get a higher level of sensitivity. But in reality, that level, if you read the article, was to get 80% sensitivity. Well, that isn't even all that commonplace. And then if you read the JOSPT article, now I'm drawing a blank on the editorial about impingement and how that term needs to probably go away because it's a way too much of a garbage term and it really tells you nothing, is important to understand. And as evidence-based practitioners, you need to be reading the literature and understanding how these things are changing, and how what we did 5 years ago, what we did 10 years ago, is not really bearing out to be reliable. And even if we go further into the Hegedus article, when you look at the SLAP test, oh my God, those are all just terrible. I mean, they're just straight away bad, right? They tell you nothing. And so if you think doing an O'Brien's test is going to give you some kind of an indication of where you're at, well, review the Hegedus article one more time and appreciate the fact that, and then the fact that, well, we don't have enough time. I'm going to stop there. Anyways, it was good stuff. And as you can see, it gets me a little bit worked up about some of the direction in which we go. All right, next block. We're going to be talking about selective shoulder disorders coming up. Be on the lookout for some virtual round announcements. Contact me if you have any questions. Please engage us, engage Eric, engage Laura. We'll be switching it up. So we'll be switching it up so that I'll be taking Charlie and Delta the next block. Eric and Laura will be going to Alpha and Beta, and I will be also giving you some feedback from the first block so that you have a pretty good idea. You're going to get feedback from me from block 1's, block 2, which is the halfway point, and then obviously at the final point for block 4. If you have any questions, don't hesitate to contact me. We had a couple of slow starts for some people who were doing this for the first time. Totally fine. It happens. I was able to get back to them. Maybe a couple of phone calls were needed to be made. It's not a big deal. Everything ends up working out fine in the long run. But just don't be afraid to contact. And then don't be afraid to dig in. Challenge us. Challenge Laura. Challenge Eric. Challenge myself. Challenge your coworkers or your learners. Do it in a respectful manner. Grow from each other. Learn from each other. So we all get better. Other than that, have a great weekend and enjoy some basketball. That's where I'm going. Bye-bye.